Okay, so I'm Meredith, and our group chose to do urothelial bladder cancer. So we'll go ahead and get started. First, we have the biology and subtypes of urothelial cancer, and there are two main subgroups, basal and luminal. And basal is typically more aggressive than the luminal cancers. And then there are three main types of bladder cancer based on cell types where they originate, and those are urothelial carcinoma, which usually makes up 90% of bladder cancers, and then even 10 to 15% of kidney cancers. And the urothelial carcinomas starts in urothelial cells, hence the name, which are cells that make up the innermost lining of the bladder. And then the next type is squamous cell carcinoma, which makes up about 4% of bladder cancers, and those start in the squamous cells, which happens sort of as like a chance mutation due to cells proliferating in response to irritation and inflammation. And then the next one is adenocarcinoma, which makes up about 2% of bladder cancers, and those start in glandular cells, which form in the bladder after prolonged irritation, which can also kind of follow the squamous cells. And then there are also three main types of bladder cancer based on classification. The first one is non-invasive, and that's exactly what it sounds like. It's precancerous in a very small tumor that is only on the inner lining of the bladder, and it can be very easily removed and completely removed with surgery. And then the next type is non-muscle invasive, which is usually classified as stage 1, and it's when the tumor has started moving out of the bladder but has only invaded the lamina propria, which is, you can kind of see in this picture, is directly deep to the urothelium, which is the innermost lining. And then the next one is muscle invasive, and that's when the tumor has grown past the lamina propria and into the muscle walls of the bladder, and it can even sometimes go into the fatty layer of surrounding tissues and organs. And then next, we have frequently mutated genes and consequences of them. And so 51% of mutations seen in bladder cancers are in the APOBEC gene family, and they're usually TCW to TTW or TCW to TGW changes in the DNA sequence, and this is commonly mediated by a DNA cytosine deaminase, and that's an enzyme that catalyzes the deamination of cytosine in the DNA sequence. The APOBEC gene family is also one of the most associated mutations that leads to cancer, and that can be seen across the board. And then in this study where this information was found, it was mentioned that the APOBEC 3B was expressed in high levels in all of the bladder cancers that were examined. And then TP53 is the most commonly mutated TSG associated with this cancer, and it was found in about 49% of bladder cancers. TP53 encodes P53, and P53 functions as a tumor suppressor gene that stops the cell cycle. If something's not right with the proliferating cell, it kind of puts it into that G0 phase. And then if the cell does not fix the issue and tries to go past that checkpoint, P53 will signal for it to go through apoptosis and commit cell death. And then the loss of this, or this mutation, leads to the hallmarks of evading growth suppression and also resisting cell death. And this is also a gain of function mutation. And overall, I found that in this study, it was mentioned there is a high rate of both mutations and genomic amplifications and or deletions associated with muscle invasive bladder cancer, which I mentioned in the previous slide was kind of like the worst classification there is.
So now to an overview of PADCEV. First things first, I wanted to mention that it is a cytotoxic anti-cancer drug, which basically means, as we know, it kills cancer cells, which is really important to note. It's not a cytostatic drug. It does not halt the proliferation of the cancer cells. It just strictly kills cancer cells. And as we said in the previous slide, it is intended for adults with locally advanced or metastatic urothelial cancer who have already gone prior treatment. And as we said, that prior treatment would have been the programmed death receptor or the programmed death ligand inhibitor or a platinum-containing chemotherapy. Now, if we want to talk about how does it work on the cellular level, what is it composed of? You have a little diagram. I have provided a diagram. What we really want to notice is the microtubule disrupting agent, MMAE, which is what actually helps to bring about the apoptosis and the cell death of the cancer cells. The other two, the fully human immunoglobulin 1 kappa antibody and the protease cleavable linker, that just helps with the microtubule disrupting agent to be dispensed eventually, and we're going to talk about that next for the mechanism of action of PADCEV. And so PADCEV is an antibody drug conjugate, and it is directed against Nectin-4, which is an adhesion protein located on the surface of cells. And I provide a little pathway with the picture, so we're just going to go through the steps real quick. So first thing that happens, and this is just based off of non-clinical data. This is just how this is how they believe PADCEV works. They're not entirely sure, but this is like the general consensus of like what they think happens like on the cell level. So first thing, the binding of the anti-drug conjugate to the Nectin-4 expressing cells. Then step 2 would be the internalization of the anti-drug conjugate, Nectin-4 complex. Release of the MMAE via the proteolytic cleavage. Then there would be disruption of the microtubule network within the cell. And then finally, cell cycle would arrest and there would be apoptotic cell death.
So for the incident, mortality, and variations, this is the fourth most common cancer in men, but it's less common in women. 9 out of 10 people with this cancer are over the age of 55, where the average age is 73. And there's some racial discrepancy that we're not 100% sure on, where whites are 2 times as common to develop bladder cancer than African Americans and Hispanics. And Asian Americans and American Indians have slightly lower rates. This is probably due to some sort of way that Americans live differently than these other cultures. For 2021, there's about 83,730 new cases, where 64,280 were in men and 19,450 were in women. Of these cases, there were 17,200 deaths, where 12,260 were in men and 4,490 were in women. So for the risk factor, I found a cohort study that compared the alcohol consumption to the risk of getting bladder cancer. So this study was originally had 120,852 subjects between the age of 55 and 69, but the bulk of the study was done based on the follow-up, the 6.3-year follow-up, where there was 594 cases of bladder cancer and 3,100 support members. So the incident rate was based off the grams of alcohol consumed per day, where in men it was based off of it was less than 5 grams, or between 5 and less than 15 grams, 15 and less than 30, or over 30 grams. Where the incident rates were as followed: 1.49, 1.52, 1.16, and 1.63, which was then compared to non-drinkers, which was 1. Men would consume any kind of alcohol, it did not matter, whereas women would primarily drink wine. But the incident rate for women, they varied. So based on these results, there was no significant association between alcohol consumption and the development of bladder cancer.
It's Colin. So what I'm going to be talking about is the efficacy and the side effect profile of the targeted intervention that we chose for our group, which is PADCEV. And in the parentheses, you see the actual like drug name, how it would be written, on prescription bottles and stuff like that. So some common side effects would be fatigue, peripheral neuropathy. And peripheral neuropathy is basically nerve damage that causes weakness or numbness or pain in certain parts of the body, like say your hands or your feet. So what they notice with patients who take this drug, a side effect could be that nerve damage would occur in certain parts. And as a result, the weakness, numbness, or pain would happen. Some other side effects would be nausea, taste changes, decreased appetite, diarrhea, rash, hair loss, dry eye, dry skin. And an important one that they noticed with Padcev is hyperglycemia, which, as we know, is high blood glucose levels. So your blood sugar would be really high. And that's important to notice because high blood sugar can potentially lead to other significant problems. And so that's why it's definitely one of the bigger side effects that they would monitor. And as with any like anti-cancer drug treatment, there are a lot of side effects. So this isn't a complete and total list. This is just the ones that are the most common that they've noticed. And at the bottom, I just included a little fun fact. It lists patients of reproductive age should use birth control while on Padcev, and it's actually encouraged because you don't want to risk getting pregnant while on Padcev, but pregnant or breastfeeding mothers should not take Padcev at all because it could lead to birth defects or some issues with the pregnancy. And so next we're actually going to talk about the efficacy, and this was noted in the EV-201 trial, and this is actually the trial that got Padcev approved by the FDA, so I thought that was really interesting to learn about. So basically with this trial, they had 125 patients, and at the end, they noticed that out of the 125, 44% of the patients had an objective response, meaning that they had noticed a significant clinical change. And of that 44%, 12% had a complete response, which is really good. It means that there was almost a total loss or complete shrinkage of the tumor, and it was a major breakthrough for that 12%. And 32% of that 44%, they had a partial response. So it wasn't a complete loss or shrinkage of the tumor, but it was still a clinically significant shrinkage or decrease of the tumor size. So that's why it was included, because of it was still clinically significant. And so as it says right there, Padcev achieved a clinically meaningful response in patients, which is why it was approved by the FDA. And at the bottom, it just goes into detail, more specifics, talking about the trial. And with Padcev, it is a treatment that is intended for adults with locally advanced or metastatic urothelial cancer who had already have received prior cancer treatment. And that cancer treatment could have been the programmed death receptor or a programmed death ligand inhibitor or a platinum-containing chemotherapy. And it's typically used as a Hail Mary almost. It's like after everything else hasn't worked, we're going to see if Padcev will help just a little bit more or just help finish the job because prior treatment wasn't as effective as the physicians and the patients had hoped for. And this is important to consider because if you're looking for a cost-benefit analysis, if nothing had previously worked, then it would be a contender to use Padcev because it would be another option that they could pursue. And if they had already pursued the other ones, then the risk benefit, it could potentially outweigh the risks with the benefits because of how effective Padcev had been seen with this trial.
As far as the clinical side of urothelial carcinoma, the clinical subtypes include low-grade superficial bladder cancers, which have a minimal risk of progression compared to higher-grade non-muscle invasive cancers, which have more of a moderate risk. And then also there is the highest, which is muscle invasive cancers that have the highest risk of progression and are usually lethal. As far as prognosis, in advanced urothelial carcinoma, the 5-year survival rate is typically less than 15%, whereas in a low grade, it would be much higher. And the spread of this is usually depending on tumor grade, whereas a grade 1 tumor has a 2 to 4% chance, whereas a grade 3 has a 33 to 64%. As far as experience on Padcev, The treatment is for adults with locally advanced or metastatic urothelial cancer whose condition has worsened after they've experienced and gone through the treatments of a programmed death receptor or programmed death ligand inhibitor, and also a platinum-containing chemotherapy. If these two have gone through and somehow made the cancer worse, that's when you are eligible to do PADCEV, which is a 30-minute IV infusion on 3 days out of a 28-day period. And then this period goes to be continued and redone until hopefully it gets better. And as far as success in a recent study, there was complete response in 12% of patients and a partial in 32%. As far as resistance in PADCEV, it's not very known. It's actually a answer to resistance in the two prior things, which are platinum-based chemotherapy and a PD-L1 expression, which PADCEV actually goes and targets those things. And known interference would be a CYP3A4 inhibitor, which can increase the incidence or severity of the toxicities that PADCEV has. Also in the study of 308, 77.3% of the patients in the successful trial were men. And this is the same one that had the complete response of 12% and partial 32%. And whereas in the same trial, women were much lower and they actually had a relative 17% increased risk of death, whereas men typically responded better. How it works is it uses an ADC or an antibody drug conjugate, and it targets Nectin-4, which is a protein on the surface of the cancerous urothelial cells. And the active ADC works with the active chemotherapy drug in PADCEV. And if you can look on the right, it binds, and then the internalization of it, which triggers the release of MMAE and allows a disruption of the microtubule network, which then progresses into cyclical arrest and apoptic cell death of the cancerous cells. As far as off-target effects, there are some severe side effects, and 46% of patients treated do experience these adverse reactions that include hair loss, vomiting, peripheral neuropathy, and ocular disorders. And it does have a relatively low therapeutic index of a maximum dose of 125 milligrams per infusion for those weighing a little bit more. And it is narrow because you typically would use this drug until you saw complete results or until your side effects and adverse reactions got so severe that treatment had to be discontinued. Thank you.